Gentleman yields back, and the chair recognizes Mr. Pence for 5 minutes.
Thank you, Mr. Chairman, and thank the witnesses for being here today. Hoosiers, and as Congressman Crenshaw is very aware, and all Americans are facing higher medical costs and fewer options for care, particularly in rural communities. Complex medical fee structures, surprise billing, and confusing coverage plans have further eroded patient trust in our healthcare system. Improving healthcare price transparency, however, would inject needed competition for healthcare facilities and ultimately lower costs for patients. This is especially needed in the Hoosier State, which consistently ranks among having some of the highest hospital prices in the country. Across southern Indiana, rural facilities are closing at an alarming rate, as they are all across the country, lowering access to care for vulnerable communities. Lack of competition has patients with fewer alternatives to access care, particularly in rural communities across Indiana's 6th district, my district. These issues are exacerbated by unsustainable workforce shortages and skyrocketing labor costs. There have been recent efforts to improve transparency, such as the Trump-Pence administration's 2019 HHS rule requiring hospitals to disclose standard charges as well as transparency in coverage requirements for health insurers. However, it is clear there is still more that needs to be done so that Hoosiers and all Americans can make the best medical decisions for themselves and their families. Dr. Ippolito, several years ago, Congress took steps to harmonize Medicare payments between various sites of care for the same services provided through a site-neutral payment model. However, the services covered under the existing policy are a relatively small portion of outpatient services, since almost all existing facilities are grandfathered in by the legislation. Do we know what portion of facilities are grandfathered in under this policy and the scope of outpatient hospital spending the current policy impacts?
Well, you're certainly right that it's a very limited policy. I don't know the number of facilities, but I can tell you that it represents less than a percentage of Medicare's total outpatient spending. I think it's 0.8% of Medicare's outpatient spending, so it affects a very small share.
Okay, thanks. How would patients be impacted if the policy were to apply to a greater universe of providers and services?
Well, Medicare and commercial market patients would benefit in the long run because it reduces the incentive to keep consolidating the provider side of the market. In the immediate term, there's an obvious benefit to Medicare beneficiaries in the form of lower out-of-pocket spending. Their out-of-pocket is often a function of the price of the service, and if that price goes down, their out-of-pocket goes down.
So it might be a good idea?
Well, I think so, but nobody voted for me, so.
All right, thank you. Mr. Chair, I yield back.
The gentleman yields back. The chair now recognizes Mr. Crenshaw for 5 minutes for the purpose of asking questions.
Thank you, the chair. Thank you to my friend